let go for shoulder.
Oh, so
Alright, just stand up and have a walk. Let me know how you feel after.
oh, gosh, that's nice.
Based on what I understand is the discomfort at the neck?
Yeah, and then like here on the side here, goes to the jaw. Just feel a bit kind of tight, especially when I'm walking. Like just now I was walking the mall, then I feel the tense already coming from my neck.
Okay.
And then the last time I did the hiking, then I feel like it's actually more painful because it kind of pulled all the way, and then that feeling headache at the same time.
Okay.
So I don't know, is it from my previous hike that I fall and then get worse, or I don't know, it's not tightness from probably my neck or something.
How long has it been there for?
5 months now. But once I started doing exercise, then it definitely did discomfort straight away.
And like what you mentioned just now, even the walking.
Yeah, just a long walk, I felt like that.
Okay. What about like day-to-day sleeping, sitting?
Sleeping time, weirdly I'm feeling more discomfort on my jaw side.
Okay.
Not so much on the neck. During the sleep in the middle, so when I wake up, I feel straight away like there's something like, make me feel like so tight right here. I do have history carpal tunnel after giving birth. So that doesn't react on that this time.
Definitely a little bit of swelling going on here. So comparing this part here when I'm pressing to the bottom one, any difference?
I think the top part I feel more.
Feel more pressure when I'm pressing it? Yeah, that feels a bit swollen. I just need you to lean back and go forward. That's pretty swollen, Zoe.
Really?
Yeah. Do you feel any pressure there?
Not really though.
Now compare this one here and the one on the left.
Feel the left one, I feel a little bit more.
Left one feels a little bit more pressure. There is a couple of spots where there's a little bit of swelling going on. In our day-to-day, sometimes when we lift heavy items, sometimes during a fall, or a fall that happened in the past, right? Like hiking and whatnot. So when you have too much pressure going through one area, the bone can sometimes shift in position.
Okay.
So when the bone is not in a good position, the joint will then suffer from uneven pressure. So that swelling will eventually irritate the nerve around it, causing a lot of tightness around the muscles. So if it's a muscle problem, it tends to go away rather quickly, just within a couple of days. But if it's a joint problem, then this is when the problem can come and goes, and it can last for months. Ideally, when we look at the spine, we want it to be symmetrical over the right side and the left side. If you look at the whole pelvis here, the right side is generally narrower compared to the left. The left side is quite a fair bit wider. This is what we call as obturator. You can see that this is quite a bit taller, that's a bit thinner. So when you've injured it, the whole thing basically comes down like that. When this is misaligned and the pelvis is not functioning okay, the one adjacent it have to work extra hard to make up to the movement that is lost here. Because it works harder, that's why it wears off a bit faster. And the muscle is gone into spasm because the nerve is affected. Yeah. That's a bit sore, right? Yeah. It starts from there. Yeah, that's where the temperature spikes as well. Tummy down all the way. Relax the shoulder. You feel some pressure, yeah? It'll be quick. Just let go for shoulder.
Oh, so good.
Okay. Okay, you can come up now.
Oh, so
Alright, just stand up and have a walk. Let me know how you feel after.
oh, gosh, that's nice. So no hiking and stuff like that? I slept well that night. And then I put the ice pack like you mentioned before I went back, and then in the morning.
Overall, the sleeping is better.
Yeah.
I think that's a good start.
Yeah.
Feel the stretch when you do that. So the muscle is definitely less tense on one side. And this here, I can still feel the muscle is tense on. That's still a bit sore. Right? This one's better.
Yeah.
Okay. Yeah, it's a top bit now. We work on the lower, the mid back last time. So that area there, seems like it's moving quite well. I'm quite happy with that. Yeah. And coming down after that. Alright, let's work on the top here today.
Sleep well tonight again.
Dream killer.
I know, right? Oh, I need that. Because normally when you drink, you're so tired. You get up, you feel, like the next day you just feel like you don't have enough rest, right?
Right.
So when I slept that night, I was like, I woke up, I was like, wow, I forgot that there's something like I haven't dreamt anything,
Right.
So it's like
So it's a really good deep sleep.
So hopefully another one takes good.
Sure. Okay. So I'm just going to apply some pressure just to get the bone back to the right position. Increase some pressure just like the other day. Coming down all the way. And let go of the shoulder. Not bad? That was a pretty good one. How's everything since the last round?
Much better.
Okay.
Less pull from the back. There's one position when I have to kind of lean back, and if I have to do this, touching, and then I felt that.
Sure.
Like really uncomfortable. Like I have to stop.
At this point of time, leg raise or any sort of movement like that probably is not the best idea.
Okay.
Instead, maybe you can try plank, hanging leg raise would be better.
Okay, so nothing on like doing that. Okay.
Yeah, because we want to avoid putting a lot of pressure on that
back.
sacrum area.
Okay.
Yeah. Today I'm going to just check all the way down even to the lower back.
Okay.
Sometimes it may be the reason as well that's causing the symptoms.
I think a bit better, right?
This part of the trapezius is better. I think the back here still, I can still feel some spasm going on. Still feeling my fixation there. Okay, look up again. Let me just check on the mid back and the lower back, okay? And let me pick up some swelling here. Okay.
That side, yeah.
Remember I told you that your spine is straighter than usual, at least for the lower back. Most of the time, because of that reason, it's very difficult for the upper neck to really settle down, so we have to really get the lower back.
Okay.
Probably settle first.
Okay.
Alright. Yes, let go. Let go. Okay. Got it. Here, don't feel as sore as just now, now. Lesser, right? Okay. You know what? I think that's all you need for today.
Okay.
Okay. I want to see what are the changes I can bring you with the lower back adjustment. Yeah, so how's everything since the last round?
Actually, it's so much better.
Okay.
I did like walk, right? Not, like Bukit Damansara, just a little elevation, not too much.
Sure.
Come back, I have no strength on the neck, and then I try again last night. Last night I walked a bit longer, 5.6.
Okay.
And so far, sure.
No problem.
Yeah. So
Yeah.
I think it's somewhere, we kind of tackle the spots probably here then, I guess.
So in the past, when you do walk like that, you will feel the strain.
I think I told you when I walk 1K, then I straight away feeling my neck and headache,
Okay.
like right after.
Right.
So even without, bags or something. So
Sure.
this week I tried twice.
Okay.
So far I was like, especially last night, I was wanted to see how I felt.
Yeah.
And no headache, no pain over here, and I sleep okay as well.
Okay. What about the tightness of the jaw so far?
Tightness also a bit better.
Generally, you do feel that it's getting less tight, right, around this region?
But for me, since many years, my shoulder is always tight.
Yeah. So the reason why this here is like really tight like that is because when the nerve is being affected, basically it's causing the muscle to go into spasm. So what it means is that this area has been having spasm for a long time.
Right.
So once everything is sorted, it should go back to a normal state, and you just lean backward. Just lean back all the way. I think the movement is quite good. Let's check on the lower back. This is good. This one. Still a little
Only
bit.
that side, I think.
Yeah, you still feel it, right?
Yeah.
You feel a bit sore on this
Right
one,
there,
isn't
yeah.
it? Yeah. So that's the L5. Yeah, we should definitely work on that. There I can still feel some swelling going on. Need to work on this one. So the L5 is stuck at this position wherever it couldn't go forward. It should really travel forward.
Okay.
So what we're going to do is to try to get this bone back to a position where it can function a bit normal.
Feel good?
Alright.
Sounds good.
Yeah. I think so far we've moved pretty much everything that we should. Especially the lower back, I'm quite happy with that. I think when I first met you, from all the things that you've been telling me, to me it's just a lower back issue. That's very obvious.
I mean, it feels good, right, when we did the first, but then I guess when we did the lower back, like, straight away, I think the first time you said it's about the lower back, but like I said, my pain was up.
Yeah.
I think the first, after the x-ray, you mentioned more on the lower back.
Correct.
And then you asked me and I said, I know, because I don't have anything from here, right? So mostly neck, that's why, and I guess in probably yearly from working, bending down, and that kind of 25 years though, and doing that side. Because of serving, right? Because we go this way, there, bend, carry, could be. Thank you.
No problem. I'm good.